Danny.
Hello, hello.
So this is Danny Gracie. He's Stillwater Medical Center social worker, Employee of the Year last year, and a real asset in the ER. I asked Danny if you would talk to us about what happens to ER patients after they head out of the ER, and how he assists them as they move out of the hospital and back into the real world. So let's talk about a couple of those.
Sure.
Tell me about our overdoses, because we laugh about those a lot in class.
Okay.
What happens after those patients? They go to the ICU. Most of the time, they're intubated. We've taken over their breathing and we're supporting their blood pressure. And then in ICU, they reverse that process. Before they go home, what happens in the hospital, and then what happens to them as far as what we do at SMC with that regard?
Sure. Once they're extubated and they are medically stable to be discharged, the doctor deems they're medically stable for discharge from the hospital. Then at that point, we consult Edwin Fair to come and do an evaluation.
So Edwin Fair is the community mental health agency in this part of the state.
Yes, and they're the ones that our hospital contracts to do those mental health evaluations. They have to be done by a licensed mental health professional to determine whether they need like inpatient psychiatric care, or whether they can just discharge with outpatient services, or whether there's not a need of service at all. And most a doctor has the ability to do that and fill out that paperwork, but our hospital has chosen to use Edwin Fair, a second party, to come and do those evaluations. So once they're medically stable, the doctor puts in an order for an Edwin Fair consult. We contact them. Edwin Fair will evaluate them either by Skype or in person.
Okay. So we have almost all inpatient or almost all in person in the ER. You do more Skype?
It just really depends.
It's
okay. Sometimes
on where that.
Sometimes Skype, sometimes the other way.
Okay.
And also, if they're an overdose in the ICU, I usually meet with them also myself, and I do kind of a comprehensive psychosocial assessment to see what how they're functioning completely at home, all the different, because lots of times when you run into overdoses, there's other things going on. There's substance abuse, there's mental health, there's family functioning crisis issues going on, and lots of times I like to be able to meet with them and help provide a lot of information about local community resources.
Okay.
Some of the Edwin Fair workers are not from Stillwater.
Right.
They may come in from different areas, or
Ponca.
Especially by Skype. And if it's determined that they don't need to be placed in an inpatient psych, then they need support services here locally, and I know those pretty well.
Okay.
So Edwin Fair will evaluate them and then determine at that point whether they feel they need to be placed somewhere, or whether they can just be discharged with outpatient services. If they need to be placed, Edwin Fair will complete emergency order paperwork.
Okay, same thing we do here in the ER pretty regularly.
The same process, and then law enforcement comes and transports them where they need to go. If it's outpatient services that they deem the need is, sometimes they will assist them in getting appointments for an outpatient facility, because if someone can, if there's a suicide attempt, even if you determine that they don't need an inpatient placement, there's still that showing there's an extreme need.
Yes.
And so I like to make sure that, as much as I can, that if Edwin Fair did not set an appointment for them for outpatient services, I make sure that they have that scheduled somewhere, or a place where they can go or know that they can go. And then it's just a normal discharge process after that. They either go home with outpatient services or none, or it's determined that they need to be placed in an inpatient psychiatric facility.
I would have assumed that all of our folks who OD'd in a suicide attempt would go inpatient after they were medically stable. That is not the case.
Not the case.
Is that about the ability to place that patient? Is that about available beds?
No, it's not. We've had some where there's no available beds and they just sit there until we can find something. Until Edwin Fair finds a placement.
Okay.
There's been some that stayed a day longer than they needed to because of trying to find placement.
Okay.
But that is all really based off of the licensed mental health professional's assessment.
Okay. So the role of the Edwin Fair, what is their title? Are they a caseworker?
Some of them are licensed. Some of them, they can be different licensed mental health professionals or therapists, marriage and family therapists, licensed counselors, LPCs.
Okay. LPCs. That's what I'm thinking.
Clinically licensed social workers.
Okay.
LCSWs. So it could be a range of,
Okay.
I don't know their exact credentials.
Their exact credential.
So, but they're called they're actual, through their job they're called crisis workers, I think.
Okay. So the crisis worker is really huge there. That report that they give is really huge.
It's really huge. Their assessment is very, very important. There are times where we may not agree and feel and need to advocate and make sure they have all the information that they need to.
Okay.
Especially if it's through Skype, to make sure that they have all the information that they need.
Hadn't thought about that. Through Skype, the written report becomes really big.
Right.
Okay.
Because, they're evaluating, a lot of what they're evaluating is, do they feel that this patient is a danger to themselves going home? Do we feel there's a risk of attempt if they were to go home?
Okay.
That's some of the things they look at. Are they currently suicidal?
Okay.
Now when you have a pretty significant attempt, you may say I'm not suicidal right now, but that still doesn't mean you're at
right.
extreme risk.
Okay.
But their assessment is what the doctors rely on, and that's who we contracted to